Okay, as we just set up for our first panel now of the day. So the format from here, we have two panels before lunch, then we have lunch outside, and then we will change tune after lunch. The discussion about the ACLs will continue. ACL injury, surgery, recovery, and prevention. This one. So if the moderator and panelists are ready, moderating this one, Betty, who is the founder of Intellectual Law. Welcome to Betty. And joining her, Jim Rainford, the sports PA broker at Miller Insurance Services, Dimitrios Tsoukas, orthopedic surgeon, and Katie and Dr. Karli. If you'd like to join us again on the stage, a round of applause. Enjoy the first panel of the day.
Thank you. Yeah.
So here we are. We just heard so much from Katie. Thank you, Katie, and Dr. Richards, Karli. I may call you Karli, right? Okay. You know, I have a lot of questions. Excuse me for a second. I think we have a technical issue, right? You don't have a microphone?
We can pass it. I can use it.
Sure. Okay. All right. Okay. I want to build on that. I want to first talk to Katie. I'm curious. You had the ACL injury. What happened when you were on the field? Did somebody come to help you? I heard you say you just walked off the field.
Not initially. So, well, yeah, at first I felt it go. As I was falling, I clung to it to protect it, and I didn't want to move at all. I froze. The players kind of looking at me, and I basically said it's fucked.
Okay. Yeah. Okay.
And so they called the physio on, and the physio came on, and I just said, don't touch me, my knee, I've wrecked my knee. And she's like, well, I'm going to have to assess you. I was like, okay, just give me a second. And that's when I took a pause, and I was like, okay, actually, it's the shock of the feeling of it that was really running through my body. But when I took a breath, I was like, okay, not that much pain. And so I started to move it. She tested it a little bit, and I was like, I just need to get off the pitch. But we'd used all of our subs by then, so everybody just thought I was being a bit lazy and needed a bit of a break. So yeah, the physio came on and helped me, but she didn't want to say what it was straight away, just wanted to take some time to make sure that was what it was before telling me.
How soon after that did you determine that you had an ACL tear?
I was pretty confident at the time, but then I was in the shower afterwards, and it kind of collapsed in on me, and I was like, okay, there's definitely something not right there. But I got a scan maybe a few days later. And then, it was probably a week and a half to 2 weeks before I found out officially. But like I said, with Leah Williamson, obviously got her scan a bit quicker than I did, so I found out that way, really.
And in light of the fact that it took 2 weeks, what happened after that?
Not a lot. I couldn't really move for a week. It seized up. I was on crutches. And I was basically, just bedridden and parked up on the couch for a week before I was able to get the scan and then go in from there.
How soon after that did you see an orthopedic surgeon who would be able to take care of you?
Yeah, pretty soon. The club were pretty good, to be fair, in terms of the medical care that I got. And they gave me a top surgeon as well to do it. So I felt in good, safe hands and well supported in that regard.
After you had the surgery, did you have physical therapy?
Yes.
How long?
Still going, still ongoing.
Still ongoing?
Yeah, it's been 5 months now. I check in with the physio most days and then go through a physical program with her.
When do you anticipate to getting back to the pitch?
The surgeon's recommended to take a full year off if I can. He said that the rate of re-injuring it is still quite high, but if you can take a year off, then that greatly reduces it. So, still some time to consider that.
If you had the ability, looking back, to change how things were done, what would you have liked to see different?
For me, I think it comes down to a lot of that stuff that I mentioned. I think throughout the women's game, we're missing adequate resources to be able to perform at our best on the pitch. I think, like I said, we get young physios straight out of school that haven't had any experience, let alone in the women's game. We're lucky if we get a doctor on the pitch at the time. All of these things that kind of add up to even just this last year, I've had 3 different sports scientists and strength and conditioning coaches because they don't fit right. And lots of these clubs are trying to develop, but it's really hard to get the right people in to support the players. And we just need more guidance, more help. I mean, there's so many clubs there that are linked with men's clubs, yet there's no support and no conversations between the medical staff for both the men's and the women's. It's just something as simple as that. If a young physio is coming into the women's team, can they access the support from the men's? Would make such a big difference. I don't think it's rocket science, but there's so much little things that could go a really long way.
I'd like to address the next question to you, Doctor. Listening to Katie speak, you as an orthopedic surgeon who treats ACL injuries, what would you like to see happening on the pitch when the injury actually happens? And does waiting 1 to 2 weeks to do a scan seem reasonable?
Okay, I have the experience of being head doctor in professional sport clubs for years, and at the same time being the orthopedic surgeon of these athletes and of these clubs. So I have the experience of both these roles. At the end of the day, I strongly believe that it has to do with money. Everything has to do with money. Why I'm saying that? Because if you want to invest money in football, in soccer, female or male, doesn't matter what, then you're going to hire the best doctor for the team, the best physiotherapist, the best trainer, all the best guys. And the reactions in the field when someone gets injured is going to be perfect because they are experienced, because they know what they are doing, and you don't lose any second, which is very important. We've seen many times players suffer from an ACL injury, even a complete rupture of the ACL. Keep playing, keep staying in the field. Why? Because the physiotherapist or the doctor was not experienced enough to understand in the field the severity of the injury, or the player was so motivated to play that he stayed in the field even more for 20, 30 minutes more, and then he came out. So first step is a very good medical team for the club during the games and practices, and experienced enough to understand immediately what happened to the player. Then time of exams. Okay, this is a very big issue. I mean, the head doctor of the team, and this is another very big issue that we have to talk about. How can you manage, how can you organize the medical team of a professional or not professional sport club? The orthopedic surgeon is the guy who is in the hospital, okay? He's not dealing every day with the team. So he's accepting, receiving the players that they have a severe injury or a serious injury, and he asks for all kind of tests that he has to run, x-rays, MRIs, and all this stuff. When you have a player, you perform an MRI immediately, same day. Even if the player got injured in the afternoon, you have the MRI same evening, no after 2 weeks. And this is something wrong to say that you have to wait because your knee is swollen and MRIs. No, this is not true. You have to do it immediately. And then, why do you do MRI? A good surgeon, good orthopedic surgeon will understand the injury immediately, but you are doing MRI to confirm the diagnosis because the player, the agent, the president, everybody has to be sure about the diagnosis. And also to diagnose other injuries as well that they may happen during injury. Meniscal injuries, chondral injuries, cartilage injuries, all this stuff. And then you have to organize the operation, which is a very important issue, and this is the topic of my speech. I'm going to talk later about the operation. So at the end of the day, I insist it all has to do with money.
Yeah.
That's it. So if you want to perform well, you need the best performance. To have the best performance, you have to spend money.
So just from this point, what we want to do is we don't wait for the examination of the player 2 weeks to determine what the problem is. The same day we get an MRI.
Look, Betty, this is not a huge mistake, but why let the player wait for 2 weeks and feel all this frustration and do it immediately and you know what you have to do?
I'm not suggesting that it is a mistake. I'm simply suggesting that what is the most prudent action to take at the injury. Would you agree with that, Karli?
Yes, the quicker you have the quicker you have a diagnosis, the quicker you can come up with a treatment plan.
Okay, and having the right people on the field at the type of the injury is very important. And in your opinion, Doctor, you believe that one of the reasons is money, which gives me my segue for Jim. You're with Miller Insurance, right?
Yeah, and
Tell us a little bit about that. How, where does a team get the money to get the best trained physios, the best trained first aid personnel on the field?
okay, I think just to elaborate really on what's been said, most people, their perception of insurance is cost. They'll go to cost straight away. The message that we're trying to get across, we work with numerous individual athletes, and the message that we're trying to get out there is it's protection. First and foremost, it's protection for the athlete. And, I've been in unfortunate situations where I've had conversations with athletes who've had a realization that they're not going to be able to play professional sport anymore. So mentally, that's hard to see the athlete go through that. But knowing that myself as the insurance provider is protecting the athlete is, it's a safety net, right? So if all else fails, at least there's an insurance policy there to, enable the athlete to transition into the next part of their life. Now, I think you look at this in two ways, really. You look at the team's responsibility, and then you look at the athlete's responsibility. Now, with the team, and again, to elaborate on your point, on the men's side of the game, they're wrapped in cotton wool. Like, as soon as they get an injury, they're wrapped in cotton wool. The turnaround, they very much are seen as assets. From what I've seen on the women's side of the game, on the medical side, is that the insurance isn't of the same standard. There's a massive disparity in that between, the treatment and protection that the women get compared to the men. And, it begs the question, well, why is that the case? The women footballers should be seen as assets to the club as well. So that's a team's responsibility. And I think with the growth of women's football as well, yes, it's great. It's getting more popular. There's more money going into the game. But I think what is also great is that it is becoming under more scrutiny. So things like medical care insurance, people are hearing, the women's players' messages now saying, well, I wasn't treated the same as one of my male counterparts. So that's good because then, it puts reputationally, it puts it on the club to do something about it. And we work very closely with Chelsea, and Chelsea's women's team in particular, they are safeguarded. The club provide very adequate private medical care for the female players there. And they also put in place a group protection policy for all the players so that if the best medical care fails, at least they've got something to fall back on and then be able to transition into the next part, of their career. I think from an individual standpoint as well, there is a lack of education on the women's side of the game as to what's out there in terms of how they can protect themselves. And, you know, it's a message that is starting to get out there, and most of these messages get delivered in the dressing room. It's the kind of dressing room chat of, you know, the ladies are talking to each other now saying, it's not a question of, you know, if I'm going to do my ACL, it's when I'm going to do my ACL. That is, you know, a message that I get fed back regularly. So, you know, there's a lady in particular, actually, who plays for Manchester United women's team, Martha Thomas. Some of the people in this room might know Martha. Now, Martha, I was introduced to her by her agent, but she's a great advocate for what we do, because there was a realization from her in that, you know, if the worst were to happen, obviously you don't want it to happen, you want to have a successful playing career, but if it was, there is insurance out there that can protect, you know, me as an individual athlete. And again, to go back to cost, you know, the first response from Martha was like, oh, how much is it going to cost though? It's going to be too expensive, right? And when we went through the process and she realized what the actual cost was, you know, the response was, oh, is that it? So, you know, she, like I say, she's been a great advocate for us, because she's now effectively, you know, part of Miller, the way that she operates, in that she is going around the dressing room saying, look, speak to this guy that I know who works at Miller Insurance, he can protect us. And, you know, the more that message resonates across the game, and it is beginning to, you know, you look at the last World Cup, the Lioness team, we were insuring 50% of the, not just the team, the squad, I should say. So, you know, them being at the top of the game, we're hoping that, you know, in the next few years, it's going to kind of transition down and the messages continue, you know, to get delivered amongst the female fraternity.
What do you think is the number one reason, and this might be very obvious, but I really want it to be said, what do you think is the number one reason that teams are not getting the proper medical insurance or the resources to provide the best medical care for their women players?
Just cost, fundamentally.
Cost.
I think it's cost, and I think there's a valuation of the male counterpart to the female player to say, well, yeah, do we want to spend, you know, money on this individual when this one's worth so much more? And it's, you know, it's outrageous. We talked earlier about a contract that I had sight of, and, you know, the injury clause in that contract for a female player was that if she was to get injured for longer than 3 months, the club could just terminate the contract outright. And, you know, that to me shows you how the club perceives women's football. Now, it is changing. Like I say, it's under more scrutiny, and more protection is coming. But yeah, I think not every club, but there are still clubs out there that, you know, just see it as an additional cost. And look, yeah, we're just going to avoid it if we can.
Okay. I have a question for you. Who makes the decision to operate on the injured player?
That's a great question. Who made the decision for your surgery?
Who? No.
I mean, not if you had to undergo the surgery, but who has chosen your surgeon?
The team doctor chose our surgeon.
The team doctor?
Yeah.
Okay. This is a very big problem nowadays. I mean, when you have a top-class player sustain an injury like an ACL rupture, then there are many factors that are coming in the game. I mean, you have the player, you have his agent, and you have press, fans, everybody. So when Ibrahimovic tore for the first time his ACL, he decided to be operated in the US by late Freddie Fu, a great surgeon from Pittsburgh. And why he decided that? Because he had the money, he had the opportunity, he was famous, and him, by himself and by his agent, they decided to go to Freddie Fu. Then when he turned his other ACL, he decided to be operated in France by a very well-known French orthopedic surgeon. But he's Ibrahimovic. When you are in, let's say, a middle-class team, professional or not, and you are a good player, not Ibrahimovic, then you have to follow a certain path. You have to follow the rules of the organization. That means that if you have to have an operation, then first of all, your agent, if you have an agent, will propose some names. But the final decision, at least here in Greece, is made by the president of the team. And the president is getting advices from everybody around his environment, which is not professional at all. So there is maybe a famous doctor, everybody's going there. Maybe the doctor is a friend of the agent, player is going there. Maybe he's a friend of the president, the player is going there. Or maybe the operation is going to be cheap. So the president would certainly send the player to go there. This is how things work. But how should they work? I think the best way to do these things is via the head doctor of the team. George Chambers will talk about that later on. He's the head medical officer of the US Soccer Association. I think he's responsible to decide who is the best doctor for the player. But still, if you want to talk about a well-organized sport club, they should already have an orthopedic surgeon working with them. And this guy should be one of the best. So there is no dilemma. You have to go to the club's doctor, who is chosen, and he's really good. But this is not the way things work. And you see in women's football, soccer, whatever, there's a big frustration because the player got injured, and then what? Then what? Karli?
Yes, and so this is interesting. In the United States, even our collegiate teams have medical team of doctors for them. So I work in a sports medicine practice, and our practice covers the local college and high school athletic teams. So we go to the games, we provide immediate treatment when that athlete is injured. Just like the doctor said, you know, the study's done right away, treatment is initiated immediately. And this is for high school athletes. And that's the way it happens in the States. So my goodness, shouldn't we be doing this for our professional female soccer players? Absolutely.
Sure.
I have a question. What makes the surgeon's performance easier during an ACL operation?
This guy here. This guy here.
Why is that?
Why is that? My nightmare is not the severity of the injury or what kind of injuries I'm going to find when I perform the scope, the arthroscopy. I don't care. I have the experience to deal with everything. The problem is the cost of the operation and what kind of implants can I use during the operation. When I am the head doctor, as I told you before, in many clubs in Greece. And not only in Greece, I also worked in Cyprus, in the best football club of Cyprus, of Apoel, a club that was qualified many years ago, 16 of UEFA Champions League. Okay. And most of the teams, they don't have an insurance coverage. They don't have. Because they say, okay, how many serious injuries I'm going to have? One during the season. This is going to cost me less than paying the fees for insurance, which is not correct. It's completely stupid and dangerous, completely. So when I have to perform a surgery, I start thinking if the team has a coverage, if they have an insurance, if the player has an insurance. If they tell me yes, then I'm relaxed. I say, okay, whatever is going to happen during the operation, it's not a problem of money. But if the president tells you you have to do the operation with, for example, 3,000 euros or dollars. It's about the same now. You're afraid if a screw falls down to the floor, then how can you put another one which costs 500 euros? So this is my nightmare. I have to be safe. I have to have all the surgical options during the operation. I have to have all the best implants for my patient player. And in order to have all these things,
We need money.
I need money.
Do you experience the same thing?
No, and here's why.
Okay.
So, as many of you know, in the United States, most people, regardless of their athletic talent, have health insurance. And if you don't have health insurance, it's usually okay. When an athlete comes into my office with I'm a foot and ankle surgeon, so with a ruptured Achilles tendon, I know that they are going to need surgery. I know what type of anchors I need, what type of graft I need. I know the hospital I'm going to do it at, and I don't even look at the cost. Because oftentimes if it's not covered, if the insurance company doesn't cover it, then the hospital eats it. So it's a completely different system. And it's hard to compare. You know, where we're at and where you're at in Greece and where you're at in Europe. I don't know all the different systems and how that works from an insurance standpoint. But I'm lucky that I don't have to think about that. If a screw falls on the floor, we put another one in. Sometimes the reps just say, oh, don't worry, I'll cover that cost, don't worry about it. You know, they eat the rep who brings the screw to the operating room.
You're talking the company reps?
Yes, the company reps. So it's not a thought that I personally have to have as a surgeon. And whenever we treat athletes, we give them the best. I don't look at cost. We just give them the best. And if sometimes I operate at a surgery center, they look at cost. And if I can't do it there with the implant that I want to use, I move it to the hospital because I know it's not an issue there. So that's a big difference. It's a huge difference.
That's why you don't have any wrinkles.
I don't have any wrinkles.
So I have a question. I have a question with regard to basically the right of a patient to decide for themselves on their treatment. And I know that if I was injured, I would like to have a say in that. I find it particularly curious that ultimately the final decision is not in the hands of the player, but rather in the hands of the head doctor. You recommended that, you know, the team doctor should be ultimately, or is ultimately responsible for making that.
With the player.
With the player. How do you feel about that, Katie?
Yeah, I trust the medical staff. I think they have a lot more, obviously, they know a lot more about it than what I do, and they know the industry and the people within it, and I trust that they'll put me in the right hands, and thankfully they did.
Okay.
Sorry, can I just provide? Sorry, I'll just provide, you know, a different scenario to that. And there was a case recently with a female footballer in the UK who was recommended a certain treatment by the club, but she did dispute it because she didn't feel like she was getting the right care from the club. She actually went to the PFA, the Professional Footballers Association in the UK, and told them what they were doing, and the PFA agreed to, you know, to fund the right care for her. That got publicised, that scenario, which again was kind of great for the game to show that, well, yeah, you don't necessarily have to do everything that the club says. I think sometimes there's maybe like a fear to kind of cross the club or speak up, but you know, that kind of, for me anyway, showed that, you know, ladies are getting more of a voice and more of a say now in what they can and can't do.
This ties into what I was talking about earlier as well, because that's an example of a WSL player, I assume, because any level under the WSL, the players aren't represented by the PFA, even though it's a question we've been asking for a long time now. So those players who need the support the most, because they aren't going to get the treatment from the club, they don't have the right medical professionals in those environments, and they can't go to the PFA for support. they have to just take whatever they're given. So, there's different scenarios for different people, and it changes a lot even at the highest level.
Okay.
If you may allow me, Betty, I would also like to say that besides the financial problem that we already discussed, I think the most important issue is ignorance. And the big mission of summits like this one that Agis and Marios have made, and we really thank them for this initiative, is that they have to educate people around football, around soccer, presidents of the clubs, managers of the clubs,
Agents.
They have to be educated about this whole stuff. They have to know the importance of a good medical staff. They have to know the importance of prevention programs. They have to know the importance of insurance coverage. They have to know all these things. So we have to educate people that are working in and around football about all these things. So it's a matter of money, but also, I think, even more importantly, it's a matter of ignorance.
That's a big one. Yeah. Oof, that's a big one.
Yes, but this is our mission, and summits like this mission. This is what we have to do. It's not just operate or choose the right shoes and feel how the player has been frustrated and has the power to come back. No, we have to educate before bad things happen. And we have to be ready before.
Well, you know, it's easy to say we need to educate, right? And there's so many stakeholders in the industry. There's the teams, there's agents, there's coaches, there's medical staff. We need to educate. But as we're sitting here today, if we were going to begin this program of education, in your opinion, who should be the first target, the first people that we're going to shoot for to educate? Is it the players? Is it the agents? Is it the clubs?
Administration of the club.
Do you agree?
Yeah.
Do you agree?
I think it has to be the players too, so that they can take accountability of what are the administrators being educated about. I think it has to be on the players.
Yeah,
But
I agree.
The first one, who's going to be? The first one.
The first one, I agree with you. I don't disagree with you that the administrators, but I
See, we're all about
Sorry, can it not be a dual approach though, in terms of can it not be the clubs and the players? Because my experience is that often players, you know, this dressing room mentality, the players buy into each other, and it's a bit of a strength in numbers in that, oh, do we need to do that? Do we need to look at that? Do we need to buy that? So I think it does need to come from the players, but also the clubs as well, because, you know, ultimately the clubs should be funding it, but via a player messaging to say, well, you know, Mr. Company Secretary, we as a team, we think that you should do this for us.
I agree that it should be dual, but I think it should start with the players. If we're going to talk about women empowerment and taking charge of our own health as players on the field, it should come from the players, because I think in one of our conversations, Katie said that, you know, a lot of the women players are just so desperate to play that many times they forget, or they give up rights, or they give up, you know, something about their compensation. They're not insisting on their agents. They're not insisting on the leadership to give them what they deserve. And health should be, you know, a right, not necessarily considered part of the compensation package.
Betty, I'm going to make it worse for you.
Okay,
Yeah.
bring it on.
First one that should be educated, it's not the president or the administration of the club. It should be the government. I'll take it even in a higher level. Why I'm saying that? The Secretary General of Sports of Greece was here, Mr. Mavrotas. He was a polo player, national captain of the national team. He played in 5 Olympiads. Amazing player. If the government understands the importance of the cost, the importance of injuries during sports, they shouldn't allow any team to participate in a championship without full medical coverage of the players. And in every single contract that the player would like to sign, it would be by the government, not the president, because the president is looking for his pocket. From the government, if you want to participate, you have to have full medical coverage of your players. So for me, it should start even higher from there.
I'm not going to engage in a debate on that because at least in the United States, your proposition would probably precipitate a Republican-Democrat debate from here to kingdom come. So I'm going to stay away from that. But I'm a firm believer that the government belongs to the people, and where I would like to see the education is to be at the player level, choosing the right agent, choosing the right team.
I do think that though, Betty, if I may, that like the players can know this stuff, but again, you just come up against barrier, against barrier, against barrier.
Exactly.
You ask your coaches, like, okay, like, you want to pay me minimum wage, can I get full medical insurance?
Right.
Oh, we can't do that. That's not within our capabilities. Okay, then who do I have to talk to? And it just, as a single player, it's hard to do that. But I agree, if you educate players as a collective, then we will have more power. But again, it's, the barriers are constantly there.
Well, one last question. What's the biggest, and I'm going to bring it across the board, what's the biggest contributive factor to a player's safe return to the pitch?
Do you want me to start? Or
You go ahead.
Look, from my point of view, I think it's comes straight down to the medical care. From the outset, what attention they get and how that is translated to the player, so they know that, to use this cotton wool analogy, which is the case, in the men's game, and they don't think for a second about sending a player to the States to see the top knee surgeon. For me, it's got to kind of start there, and then that will enable the player to know that actually, these, I feel like the club are really looking after me.
Karli?
I think a big part of it is time after injury. They have to have the appropriate recovery time. Like you're taking an adequate amount of time, Katie, a year. But a lot of, and I don't know much about the pro level, but a lot of our high school players, they try and get some of these kids back at 6 or 7 months, and that dramatically increases your risk of repeat ACL injury. So there has to be good medical advice. Like you said, they have to be working with their surgeons, and they also have to be working with their physical therapist or physio to make sure that that opposite leg and knee is strong enough to return to play. And there are several tests that the physio does to determine whether the player is ready to return to play or not. So it has to be done safely and with the appropriate direction from the medical team.
Doctor? Dimitri?
Best operation, plan, best operation, best rehabilitation, based on not time criteria, but based on tests, sport test criteria, and psychological support.
I was just going to bring up the issue of mental health. It's one thing we didn't touch on. To the medical speakers, what kind of mental health support services do you feel are necessary during the recovery time of the injured player?
In my talk later on, I have some slides about this issue, because during the years, I feel that it's crucial providing to our injured players psychological support. And first years, when I would start operating, I thought that all it has to do with good operation and good rehabilitation. And we didn't consider how the psychological status of the player was that important, that we know now. So a sports psychologist, I think an experienced person has to be with the player during the whole procedure of the rehabilitation, if it's possible, or at least to provide his knowledge during certain stages. But the worst operations I performed in my life were not technically, were operations that I didn't realize from the beginning the psychological problem of the player. I didn't realize, and I'm accusing myself for that. And most of these players, they got re-injured because they were not psychologically 100% safe to come back to sports.
Like they say in Greek, right? Nous and somaties, healthy
Exactly.
mind and a healthy body. You need to train both.
Yeah.
Katie, you've spoken. We're sitting here talking about ACL injuries. We've talked, you know how I feel about empowering players to stand up for their rights. If you had the ability to advise every player out there, what would be your advice based on your experience and the knowledge that you have acquired over the years? What would you say to them?
I think you might need to ask me again at the end of the summit, because I feel like I'll get a lot more information after that. But I think, know your rights and know your worth, I think. But again, there's such limited playing opportunities at that high level that sometimes if you want to play, you have, at the moment, the deal's just not what we want it to be. But we're seeing it grow, we're seeing it develop. I think, I think we just need to keep pushing for those changes. And I think what these guys have said is all those key elements, I think, add to the confidence of the player to get back on the pitch and start doing the business. So I hope to be there one day and, back on the pitch scoring goals again.
I love your statement, know your worth. All women across the board is know your worth. And so I thank you for that, and that's a lesson for all of us. What about you, Karli? If you were to give advice at this point.
So I think education, provide education to your players, to your coaches, to your clubs, to the managers, to the trainers, about what we can do individually and also collectively to help prevent injury and also just understand our own bodies, the way they work, and help support women in their uniqueness as female athletes. So I think education is...
I just want to add one factor that at least in the United States plays a huge role is parents, right?
Correct.
So we also need to educate the parents of athletes and specifically the parents of women athletes that this is a lot more complicated and a lot more complex than simply giving them a ball and telling them to run down the field. And you, Jim, what would you say to players?
I guess really just to elaborate on what Karli said, and for me it comes down to education and taking an interest in what's going on outside of football, what's being put in place for you. And I use an example that we deal with many big sports agencies, and they're looking after very high profile athletes, but 2 years ago, one particular agent who will remain nameless did actually come to me and say, I'm starting to represent women footballers now. Can you insure them? Is because there's not really enough money in it, is there? And my response was, well, yeah, of course we can insure women footballers, because ultimately it's relative to that individual. Like just because a female footballer plays for Chelsea Women's FC and earns X, but Kevin De Bruyne at Manchester City earns Y, doesn't mean that both individuals can't be insured. It's just finding that, relativity to it, and then you're good to go.
So I want to thank all our speakers today that have been here. I hope we answered some of the questions that you may have had as Karli and Katie presented the issue of her ACL injury to us. And thank you all for your attention and for coming and making this a really special summit again this year. Two questions.
Hi, thank you. That was brilliant and really interesting. In France, we have a lot of conversation regarding women's health and how the general system is adapted to, how doctors are trained, how physiotherapists understand the women's body, and we feel that, some feel, not all, that women have been treated like little men and their health handled like that. So at the question, who should be trained first, I felt that maybe doctors, maybe physiotherapists, maybe all the performance staff should be trained, and as the game is developing, we need more and more of these people understanding what it is. So you are a brilliant person, you understand that, you're the two doctors, but I don't think we have enough of medical staff knowing the women's body. So I just thought that was my question. I would put these people first in terms of training and education.
We don't even have enough good medical staff knowing male athlete that well. And you're asking for a female. I totally agree with you, totally. We need a new generation of doctors, physiotherapists, sports trainers, new generation, completely trained on sports injuries for males and completely differently for females. The problem is, and during this summit I've been very honest in a way that maybe someone could call me not that polite, is that most of the teams, what is the criteria to make a good medical team in a sport club? Volleyball, basketball, national team. What is the criteria? Who chooses the medical team? Who chooses the medical team? Gilberto Silva, behind you. Who chooses the medical team? This is very important. And which one from the medical team has all the necessary training and certifications to do this job? Very few. We choose friends, we choose convenient people, but who has the necessary knowledge to do this job? So it's not, in this point, only for female. For me, it's also for male athlete, the problem, that we don't have adequate, well-educated sports medicine staff. That's why I said, I'm sorry, Karli, that we have to start from the administration and maybe from the government, because someone has to press others to do their job. Because the players, yes, they have to be educated, but they don't have the power. Or they have the power, but they don't let them express this power. So if the president is forced by the government, by law, to follow some rules, to choose the right doctor, the right podiatrist, some rules, we have to have rules to choose people. This is very important. Otherwise, nothing's going to happen, nothing. It's not only male and female, it's about sports and sports injuries in general. I'm sorry talking so much. I'm sorry.
Hi, Jeff Mostyn. So I have a question for the panel. I think one of the underlying themes of this session has been many conflicts in decision-making and priorities. And my question is, within a professional football club, there is always a conflict in terms of your asset. The only time that asset has a value is when he or she is on the pitch. And there must be many occasions that you've experienced of, during the recovery period, decisions being made to get that player back on the pitch prematurely. What are your thoughts on that?
Karli.
So I think pushing a player to get back on the pitch early is of detriment to both the player and the club, because the risk of them re-injuring themselves is high. So I think from a financial standpoint, that would not be wise, because if the player re-injures themselves, you're going to lose a lot more money. So when you look at it financially, it's not a good idea. When you look at it from the health and well-being of the player, it's really not a good idea, because they're going to get injured again, and then that mental state that we talked about is going to go like this. I mean, one ACL is bad, two ACLs is awful.
Sorry, just to continue with that, I couldn't agree with you more, so the question wasn't personal. My view is, are you as a surgeon, consultant, influential in trying to ensure the safeguarding of the player that's under your care? And does that influence always benefit the player if the club are overriding what you're saying? How do you actually manifest that decision so that it's positive for the player?
So I think as a surgeon, we provide medical advice based on studies and information that's done on return to play. And if a player and or club choose to override that, then that's on them. You know, we put it in our notes, we document it, they say this is what you need to do and this is why. And this is the medical literature that supports this decision, but you know, we can't control what's done after that. And I'm sure you have more of the...
Not really, I don't have more. I would say
I do.
that...
Two more.
No, you covered perfectly. I have a more general philosophical perspective on that you asked. I mean, if you want to be the head doctor of a high-level club or of a national team, you have to be a high-level person as well, not only a doctor. You have to be influential, you have to persuade people, you have to make people respect you, not only as a doctor, but also as a person, as a guy. So we care about our patients, maybe more than money and what the team is going to lose without having the player on the pitch. Our decision is made on the best that we can offer to our patients. But if you are just a doctor who is doing his job and you are not really experienced and influential, nobody's going to listen to you. Not the president, not the press, not... whatever you say, everybody has to be 100% sure that you are saying the right thing, and they have to follow you. So I'm coming back again to what for me is the main problem. Who is choosing the medical staff in a team, and what are the criteria for someone to become a member of a team's medical staff? This is the most important. If we don't solve this problem, then we're just talking around and round and round. Every year we're saying the same things. I'm listening to this conversation about 20, 25 years now, and we're still in the same point. I don't have to prove that I'm not an elephant. Why? Why do I have to prove it? You choose me to be your head doctor. You have to listen to what I say. You don't listen, I quit. I don't quit. I don't deserve to be there.
Has that happened, Doc? Have you been squeezed to the point where you've had to quit?
Many times.
Yeah.
Not just once. Financially, they didn't pay me, and they disagree with what I said medically. You know what Hippocrates, we are here in the land of Hippocrates, said? You have opinion, and I respect your opinion, but I have knowledge. So finally, I don't give a shit about your opinion.
Not many people do.
Well done.
2 more questions. Karen.
Yeah, I'm trying to remember my question. Yeah, it was related to what needs to change, who we need to address the problem to. And I don't know if you know, but there's a great book called The Gender Data Gap by Caroline Criado Perez, where she, apparently, the animals that are tested on in labs for pharmaceutical products and for medical research are male because periods get in the way. So if they were female as well, we might know more about how hormones affect the bodies of female athletes, and we might have more information about what we can do to address these causes, and that information might get to the government and to doctors who want good social outcomes, but don't put their money in the right place. So we're trapped in a system that is designed for men. And we have to acknowledge, that yes, we need more data on male players and surgeries, but there is even less on female players and surgeries. So we can't say we need information on everything. Yes, we do, but the problem here is about empowering women to overcome these injuries, because when you've got a house that's on fire, you don't worry so much, about the capable person that can walk out of the house and run away. You get the baby that still has so much more development to do, and you pick it up and you run out of the house. So yeah, I just wanted to say that the whole thing about this amazing summit is that we are empowering women. We're investing in women, and we need to, come out of here addressing those particular problems that exist. And then men will, in my opinion, be better off too.
Right, so the lack of data on female injury is significantly low. And we can't make appropriate medical recommendations if we don't have that data. So I think that we need to really invest in that research for our female athletes. That's the ground level. We can't get to up here to make all these great recommendations and treatments and without the data. Like, I can't give you an answer if I don't have, the recipe. So we need to look at all of those things, and we need a big number. We can't just study one football team for a year. It has to be thousands. We need to look at thousands of players for several years and track when the injury occurs, what their internal and external environment looks like, so we can say, okay, this injury happened on this field wearing these boots during this phase in the cycle, doing this strength and conditioning program. And then we can look at all of that and make better recommendations so that we can help our athletes.
And we're here, as athletes are here, and we're ready to participate in that. It's just, can we get the funding and everything else to go around it? Hopefully then we don't need animal testing on females to get it done.
So I just want to say that, going back to your point about women athletes being treated as little men and women's physiology and women's doctors in general, in law schools in the United States, there is this concept of feminist legal theory, and it's basically women standing up and looking at case law that has been passed down from, generation after generation, and actually pointing out during the case law how judges issue decisions in a very paternalistic manner, and treat women as if they're children. And so there's a big push among women attorneys who aspire to empower women across the nation to actually not seek decisions that actually disempower women, but rather put them in a position where they're empowered. And so perhaps maybe at the medical school level, we have, just like we have at the law school level, right, feminist legal theory, have feminist medical theory, where women are treated as an individual and therefore as a standalone, separate from men, with their own issues, their own concerns, their own health problems. I'm aware that cholesterol, for example, all the tests that show you're supposed to have 200 or less are all done on men, and women are held to the same standard, and that's not entirely accurate. So perhaps it's time for a feminist medical theory as well. One more question.
Thanks very much. And I found all your insights and knowledge and competency about your individual areas really inspiring and insightful this morning. So thank you very much so far. I'm glued to the conversation. I'm not sure if I have a question, although it would be great if you wanted to answer some of my points. But I'm a board director for Women in Football, and so we are championing women's empowerment, driving change, advancing things all the time. But I have an issue with everything we're saying, because whilst I agree with women's empowerment, of which I do every day. I drive gender change every day. I believe that it's all about education for players, and I think that's absolutely right. But the players aren't the one making the decisions. The structural inequalities and structural inequities that exist are because most of the game, the women's game, is run by men. And I love men. I'm married to one. I have one as a son. Okay, so, I don't know, Renée Zellweger said in the film Jerry Maguire, men are the enemy, but I love the enemy. Okay, so the thing that's really important is that this can't be managed by governments because clubs are private. And we've just had a fan-led review in this country where what's probably going to result in the UK is an independent regulator trying to make decisions, and none of it's all about health. Really, it's less about health, it's more about fan ownership and golden share and all those things. So maybe the research for all of this, for medicine, needs to be sponsored by the government, because that's within their gift to provide the money to academic institutions that can actually do that. So that's one thing. But is it convincing heads of federations, heads of clubs, to actually look through the lens of a woman in making decisions for the people that are the stakeholders, the biggest stakeholder in the commercial operations that they're sponsoring? So, for instance, piece of, Spanish Football Federation, I don't have to go back into the Spanish KISS too much, but, 140 people on the Spanish Football Federation and only 6 of them are women. Well, we know who's got the power there. So it's about how do we transfer the power to the people that can make the decisions, that can say, this is what we do. So that's one thing. There's another one, which is there isn't enough money in women's football in order to really write this at the level we need to write it at. And I think, back to what you said, Karli, we need that investment really early on. You said that, Katie, we need that investment really early on. So if we can convince people to invest from a research point of view, from a medical knowledge point of view, and an education point of view, and a sponsorship point of view, because it all comes down to commercial sponsors wanting to be involved in something that we think is an amazing product, which is women's football. And it's different, like women's tennis, it's different. Women's cricket, it's different. Women's rugby, it's different. It isn't men's football, it's women's football. It needs to be treated with that respect and that equity straight away. So I think we're in a very difficult situation here. I think just talking about it really blows the lid off all of those really difficult conversations. But I think, make no mistake, most of the people that hold the power over individual clubs are men. And maybe we need to somehow push that imperative. So they have to want to be interested in this. They have to see that there's a mental health angle. There's the S in ESG. There's a societal and social angle that is really important. That if we do right by this, everyone gets to benefit. And most importantly, the next generation of women, next generation of girls coming up. We don't want people to get injured and never to play because there wasn't enough finance or care that picked them out of the system. So a lot of talk, a lot of interesting things I hopefully said, but I just think we're stuck in a structural inequity at the moment and a structural inequality. And we need to maybe change the power to having more females in leadership at the top of these organisations, because then they'd care.
These conversations are really important because one of the things that we need to really start focusing is not just talking generally, but start putting our collective minds together for the purpose of creating leverage. There is no way that we're going to be able to convince the powers that be, because they are dominated by men, is what kind of leverage do we create as women players, as women in boards, to be able to negotiate and bring all this and get the types of sponsorships that we need in order to get the data, in order to get the science. Because without leverage, we don't have anything. And yes, we are encouraging people, but I'm an attorney, I represent a lot of companies, and I will tell you, every time we seek investment from potential investors, the question they ask is, what's in it for me? What leverage do you have in order to convince me to put my hand to the pocket?
So here's, sorry, that's not working. As far as investment, wouldn't you rather invest in injury prevention than have to pay money for losing your top player? Are you going to spend more money investing in data analysis or more money when your best need is off the field?
Okay, so at this point, I've been motioned that I have to cut it. So I want to thank everybody for your contribution to the discussion. Thank you so very much for your attention. Thank you, speakers.
Thank you very much.